Honorable Vincent Assefuwa, Old Tafo.
Thank you, Mr. Speaker. In accordance with Order 883 of our standing orders, I rise with authority from the Honorable Vincent Assefuwa, Member of Parliament for Old Tafo, to ask the Minister for Health the timeline for the completion of the maternity block at the Tafo Government Hospital. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. I wish to inform this August House that both executive and parliamentary approvals were duly secured for the financing and supply contract related to the Tafo Maternity Hospital project. Additionally, value for money negotiations were successfully concluded. However, Mr. Speaker, as you may recall, in January 2023, the government, through a circular issued by the Ministry of Finance, suspended payment on external funded projects. As a result, the Dutch Bank AG, the project financier, was compelled to halt the necessary processes required for project effectiveness. Consequently, the project has been temporarily put on hold due to the debt restructuring. I thank you, Mr. Speaker.
Very well. Yes, Honorable Gloria, any supplementary question?
Yes, please. Mr. Speaker, has the Ministry of Health engaged the Ministry of Finance to find a new funding or support to complete the Tafo maternity block and other health projects?
Yes, Honorable Minister.
Mr. Speaker, we are still pursuing the same source of funding, but it has to do with the debt restructuring. And so as and when we sign the bilateral agreements with them or conclude on the restructuring, we think that we've not hit the rock yet to be able to change course. It is due to the debt restructuring, so we are still pursuing the source of funding. Thank you.
Thank you very much. Yes, Honorable Gloria.
Mr. Speaker, what temporary steps has the ministry taken to reduce overcrowding, lack of staff shortage at the Tafo Government Hospital, where the maternity block remains suspended?
Yes, Honorable Minister.
Mr. Speaker, I thought we were talking about construction of maternity. We are now veering into the issues
members, please allow
issues of recruitment of workers and what have you.
But he's talking about
overcrowding.
Overcrowding, yes.
Mr. Speaker, what I can assure the honorable member is that we have a program for that facility, and we'll go according to what we have, the program we have. Thank you.
Thank you very much. Yes, Gloria, I'll give you last.
Mr. Speaker, please, I want to find out with the minister that how soon?
Yes, Honorable Minister.
Very soon.
Honorable members. Yes, leader.
Mr. Speaker, with all due respect to the minister, I think the answer he has provided is completely inadequate. Minister, you can do better. So please kindly just respond to the question. But your response
Minister,
is inadequate.
the leader is your friend. Look at
so, Minister, you know, Mr. Speaker, he's my former friend, so he should be able to.
Speaker, this house is a house of records, and I don't expect my colleagues want me to lie to the house. This project is dependent on the conclusion of the debt restructuring. I must know when the debt restructuring will end before I can tell you when we can even have access to the source of funding. So, Mr. Speaker, we are pursuing it, but with the greatest of respect. I do not want to be called to appear before the Government Assurance Committee, and therefore I am being very careful here.
Thank you very much. Honorable members, this is a constituency-specific question, so we will not rule out any supplementary question to any member. So we turn to question 262. 262. Honorable Member for Suhum, Honorable Frank Asiedu-Bequin.
Thank you, Mr. Speaker, for the opportunity. I will arise to ask the Minister plans the ministry has for the expansion and refurbishment of the emergency ward at the Suhum Government Hospital.
Thank you very much. Honorable Minister, Suhum Government Hospital.
Mr. Speaker, thank you for the question. The ministry fully acknowledges the essential need for a well-functioning and adequately equipped emergency ward at Suhum Government Hospital. At present, the expansion and refurbishment of the emergency ward has not been captured under the 2025 fiscal year budget. However, the ministry intends to undertake a detailed assessment of the facility to determine the scope of work required. Based on the outcome, the project will be considered for inclusion in the capital expenditure program in the near future. Mr. Speaker, I wish to assure this August House that the ministry will prioritize this intervention to strengthen emergency healthcare services for the people of Suhum and its surrounding communities. Thank you.
Your choice of words, in the near future. Meanwhile, 2026 budget is coming. Why don't you say 2026 budget? Anyway, honorable member for Suhum.
Mr. Speaker, nobody should think that that facility belongs to only Suhum people. Because if you travel from Accra to Kumasi, you pass through Suhum. Those from Akosombo, Koforidua, going to Winneba, Cape Coast, they pass through Suhum. So between January 2025 and September, we've had 263 reported accident cases in Suhum. So I want the minister to assure us if he's going to fast track his assessment of the situation in Suhum, because the Suhum Government Hospital serves a lot of people, including people who live outside Suhum. Can the minister assure us of some assistance?
Yes, Honorable Minister. He has given the importance of Suhum Hospital.
Thank you, Mr. Speaker. Mr. Speaker, I wish to reiterate some aspect of my response. And I quote, the ministry intends to undertake a detailed assessment of the facility to determine the scope of work required. Based on the outcome, the project will be considered for inclusion. So, Mr. Speaker, I think what the honorable member needs to do is to work with the ministry so that we can assess the situation and see what we can do. Thank you.
Well. Honorable Asiedu-Bequin, at times it's better to one-on-one deal with the minister. So work with him. So let me take your last supplementary question.
I hope to state that in trying to collaborate with you, I should meet you in the office. Currently, if there are accident cases, you go and you find patients lying on the floor. Can the minister come in with some temporary measures to ameliorate the the situation in Suhum.
Yes, Honorable Minister.
Mr. Speaker, I fully agree with the honorable member that the Suhum Government Hospital is at a very strategic position that serves anybody who plies on the road. And so, as I have already indicated, you should work closely with my office, and I can assure him that we are in to serve the country. We will do our best. Thank you.
Thank you very, very much. Honorable members, we will turn to question 263. 263. Honorable member for New Juabe North, Honorable Nana Osei Eje.
Mr.
Yes.
Speaker, I stand on Order 883 with the express authority of Honorable Nana Osei Eje, and with your permission, to ask the Minister for Health the status of the Eastern Regional Hospital, which has been abandoned after 70% completion.
Yes, Honorable Akando, Minister. The way you are smiling, it means we are going to give a straight.
Mr. Speaker, the design, construction, and equipment of the Eastern Regional Hospital was awarded in May 2020, 5 years ago. The project made progress to attain a completion of about 57%. However, the project stalled due to the debt restructuring. Mr. Speaker, as indicated earlier, the Ministry of Health, in collaboration with the Ministry of Finance, will consider resuming once the processes for the debt restructuring is concluded. So, Mr. Speaker, if the project was abandoned, it was abandoned long ago, but we will go back to site and do the needful. Thank you.
The way you were smiling, I thought you were coming to give different response. Yes, honorable member for Forukrum.
Mr. Speaker, no further questions.
Very well, thank you. So, honorable members, we turn to question 326. Honorable Dr. Thomas Winsome Anaba, a member for Garu. Doc, you have the floor now.
Thank you, Mr. Speaker. I rise to ask the Minister for Health the measures the ministry is taking to complete the Garu District Hospital.
Honorable Minister, Garu Hospital.
Mr. Speaker, I wish...
Honorable member, may you put off your mic? Very well.
Mr. Speaker, I wish to inform this honorable House that the Garu District Hospital project in the Upper East region forms part of the Agenda 111 initiative. The project had achieved an overall physical progress of 63% as of December 2024. Following government decision to rationalize the implementation framework of the Agenda 111 program, the Ministry of Finance, by a letter dated 13 February 2025, formally advised the Ministry of Health to incorporate all Agenda 111 projects into its annual budget proposal from 2025 onwards. Subsequently, His Excellency the President, through a directive dated 20th February 2025, instructed that the oversight and implementation of the Agenda 111 project be formally transferred to the Ministry of Health. In line with this directive, government commissioned an audit of all ongoing Agenda 111 sites, which is currently being undertaken by Measures Architectural and Engineering Services Limited, AESL. The ministry is presently awaiting the submission of AESL's final report and accompanying recommendations to inform the next course of action towards the continuation and completion of the Garu District Hospital project. Thank you.
Yes, Dr. Anaba, Any further questions?
Mr. Speaker, thank you very much. Let me thank the Minister for his answer, but I would like to explain that the Garu District Hospital is very necessary to be completed simply because Garu has never had a district hospital. We used to patronize the Boku Hospital, but due to the conflict and crisis in Boku, we no longer have a hospital where we go to get sick health. That is why the government decided to put up the Garu District Hospital. And as it is told, most of the staff who were in the Boku Hospital have been moved to either Zebila, Binduri, Garu, or Timpani. But if you check around the Kusak area, out of the 6 districts, none of them has a district hospital. So we think that completing the Garu Hospital is very imperative to ensure that at least it caters for the other district or even help reduce the burden and pressure on the Boku Hospital if it resumes work. So I would like to plead with the minister to ensure that when they are considering hospitals to be completed, at least the Garu District Hospital should be part of those few hospitals. Thank you.
Thank you very much. This is not a question. So, Dr. Kabil, this is a constituency. This is not your constituency.
Mr. Speaker, the response from the minister goes beyond the specific constituency. And if the response of the minister is far and wide, it's only well and good that we are allowed to ask questions within the response of the minister. Mr. Speaker, I would think that Garu was one of the many districts without hospitals. And Nana Addo Dankwa Akufo-Addo vision to make sure that every district, and he mentioned that none of the districts in that particular enclave has a district hospital, but through the Agenda 111, all of them would have had district hospital. Mr. Speaker, the problem with Garu, I know Garu personally, and I know the specific hospital. Mr. Speaker, in fact, of all the hospitals in the Upper East region, Garu District Hospital is one of the hospitals that have gotten at least considerable percentage of work done. The work done on that particular hospital means that...
Doc, just ask the question. Just ask the question.
Mr. Speaker, I want to find out from the minister if this so-called audit, that this so-called audit, that is to be done on the Agenda 111. You can wait for your statement to be made. Mr. Speaker, I'm being harassed. I will need your protection. Mr. Speaker, I want to find out from the minister. Public accounts is way to go and do your work. Mr. Speaker, I want to find out from the minister this so-called auditing by the auditor or forensic audit, whatever he terms it, on this particular Agenda 111. What is the goal of that auditing, and how soon are we going to get the audit being done? What's the goal? Because work is being done.
Honorable Kabilu, respectfully, you are changing the question entirely. I hate to do that, but if you are asking questions directly to Garu, fine. But now you are shifting to auditing and those kind of things.
Mr. Speaker, he mentioned in his response that they have engaged an auditing firm to do an audit of the projects. Agenda 111 project. I didn't introduce that, Mr. Speaker.
Honorable Minister, so he said, what's the intent of the audit? If you can tell us something.
Mr. Speaker, you take office and you have ongoing projects. You need to understand where the contractors have gotten to, how much has been paid, especially so when you don't have a dedicated source of funding for the project. And then as government, you strategize to see how you can get money to continue all these projects. So, Mr. Speaker, you must understand what you have inherited. That will inform your strategy for securing funding for the project. Mr. Speaker, let me assure this House But His Excellency the President has indicated time and again that he is not going to abandon any project he has inherited, ongoing project that he has inherited. And therefore, I can assure the House that we will tackle any project that we have inherited in due course. Thank you.
Thank you very much. We turn to question 492. Question, Dr. Anaba.
Mr. Speaker, thank you very much. Once this is a House of Records, I want to correct misinformation. Garu had a project from the NDC government in 2012 by NMS to build a hospital.
Honorable Doctor.
So to say that Garu never had a hospital, there was a project ongoing. Your government came and stalled it and put it in the infrastructure tracker that you are building a hospital in Garu, which was not true.
Honorable Dr. Anaba, respectfully.
Thank you.
Respectfully. Leader.
Actually, I was outside when I heard the follow-up question about Garu. I rushed in because I thought that there was some misrepresentation that needed to be corrected. And I think that is what the member for Garu is trying to do. The questionnaire actually mentioned Garu as a beneficiary of Agenda 111. But that's not the case. The Garu Hospital was started by the NDC 9 years ago, or even more. And then when the NPP took over, they stopped the project. So for 8 years, nothing happened there. Materials that were mobilized at site were all vandalized and stolen until NDC has come back. And so that is why he's asking the minister what is going to be done to complete that hospital, whether it will be prioritized. So when you do a follow-up question and then you present it as if Garu was a beneficiary of Agenda 111, I think that the record needs to be corrected, that Garu was not a beneficiary of Agenda 111. Boku was not a beneficiary of Agenda 111. I have not seen Agenda 111 in Pusga. I have not seen one. I only know that because the NPP won Binduri constituency, that is the only place that was assigned an Agenda 111 hospital.
Leader.
The rest didn't get any Agenda 111 hospital.
Leader. Leader. I think
Mr. Speaker, Mr. Speaker, Mr. Speaker, I think the majority leader didn't get the right briefing, because if you look at page 7, response from the minister on the question 326, the minister admitted that it is an Agenda 111 project. But that's what the answer. The minister said, Mr. Speaker, I wish to inform this honorable house that the Garu District Hospital project in the Upper East region form part of the government flagship Agenda 111 initiative.
And he himself admitted, he himself said it's Agenda.
Honorable members, please.
10 kilometers. No, what be benefiting from big push? No, they suspend the way. They are big push. Yes, they're being starting when they
whose microphone is on, please?
Okay, so Mr. Speaker, if the NPP government decided to adopt that project, please, let's listen to each other. Please, let's listen to each other. The minister is sitting here. I know the hospital. The member of parliament is sitting here. He knows the hospital. And the minister's records will show that this is a hospital project that was started under the NDC.
it was stopped by the NPP. Then after COVID, when MPP decided to do Agenda 111, they may have added Garu, but nothing was done there. Nothing was done there. I'm saying that you took all Agenda 111 hospitals. When the president announced Agenda 111 hospitals, they were supposed to be new hospitals to be constructed. We all listened to him during the COVID when he announced it, that the government was going to construct new hospitals from the scratch. When you decided to adopt the hospital at Garu, then you had moved from your original objective and the Agenda 111. And I'm saying that I would have been happy if after adopting it, you had actually completed the hospital. But even after adopting it, you failed to complete the adopted hospital.
Leader, thank you. But I think if there's any confusion, probably it might have emanated from the minister's response that it was part of the Agenda 111 hospital. So,
Mr. Speaker, you see, don't be too diplomatic with the majority leader. You see,
am I being diplomatic to him?
You are being too diplomatic with the majority leader. The minister is seated there. Mr. Speaker, before even the majority leader walked in here, the questioner had admitted that apart from Garu, all others had district hospitals. By then, the majority leader wasn't here. And if you look at the question, Mr. Speaker, the minister admitted clearly that this is an Agenda 111 hospital. But unfortunately, minister, for some reasons, decided to allow the majority leader to consume him. You see, you don't do this. You don't do that, Mr. Minister. You are in charge. The ministry is in your hands. It is just the chamber that is in the hands of the majority leader. Don't let him bully you. This is an Agenda 111 hospital.
Thank you.
Mr. Speaker, 63% of the project is done. 63. You have admitted. No, I'm not debating. I don't want, you see, you are my friend. I don't want the majority leader to consume you.
Thank you.
Don't allow yourself.
Thank you, Honorable
Let the
Martin.
records reflect that it is an Agenda 111 hospital.
Thank you very much.
It is not. Thank you, Right Honorable Speaker.
Honorable, thank you very much. We will now turn to question 492. Question 492 from Garu. Let's come down to Ejuso. Honorable Member for Ejuso, Honorable Kabrabo Ating.
Thank you,
Take the floor
Mr.
now.
Speaker. Mr. Speaker, respectfully, I'm on my feet to ask the Minister for Health whether there's any plan on paper by government to establish a nursing training college in the Ejuso municipality. Thank you.
Yes, Honorable Minister.
Mr. Speaker, I thank the honorable member for the question. The Ministry of Health recognizes the importance of expanding training opportunities to meet the increasing demand for skilled nurses and midwives. However, at present, there is no official plan or approved documentation for the establishment of a nursing and midwifery training college in the Ejuso municipality. Mr. Speaker, the ministry currently oversees 94 nursing and midwifery training colleges across the country, 14 of which are located in the Ashanti region. Before any institution is established, the ministry, through the Human Resource for the Development Directorate, conduct a comprehensive needs assessment and feasibility study. These assessments take into account regional equity, availability of clinical training sites, financial and staffing considerations, and the accreditation requirement of the Nursing and Midwifery Council and the Ghana Tertiary Education Commission. Mr. Speaker, while the ministry has received expression of interest from the stakeholders within the Ejuso municipality, no formal proposal has yet been submitted or approved through the ministry's internal processes. That said, the ministry remains open to collaboration with metropolitan, municipal, and district assemblies, as well as development partners, to explore the establishment of additional training institutions in underserved areas as the need arises, particularly for post-basic and specialist training programs. Thank you.
Yes, Honorable Kobra Boateng.
Mr. Speaker, thank
Any
you.
further?
Yes, Mr. Speaker, by way of laying basis for my next question, I would like to say that the Ejoso municipality is a youthful population. The size is about 74,000. Mr. Speaker, we have about 8 senior high schools churning out graduates, of which some of them may want to pursue a career in nursing. The municipality is also an urban one, hosting about 46 major towns. 2024 projection, population projection is about 196,000. Mr. Speaker, I would want to find out from the minister if these are not necessary imperatives which may warrant, Mr. Speaker, an establishment of a nursing training in the municipality, looking at, Mr. Speaker, the indices that I have enumerated. Thank you.
Minister, have you heard the imperatives? Very, very necessary ones.
Mr. Speaker, all the factors he has enumerated are all very necessary requirements. Thank you.
Minister, I didn't get your answer well. Yes.
Mr. Speaker,
Minister,
the questioner
he's
only
your
asked,
friend, though. So
yes, the questioner only asked whether or not the factors he has enumerated are not necessary imperative for the establishment of a nursing training college. Is that not my question?
Yes.
Is that not the question I'm supposed to answer? I say yes, they are.
So you are going to give established one?
Mr. Speaker, are you asking the question for him? There was a very simple question I'm supposed to respond to.
Yes.
He didn't add that. Did he? He didn't add that. So, Mr. Speaker, I will read some portions of my response. I'll repeat them. That the ministry remains open to collaborate with metropolitan, municipal, and district assemblies, as well as development partners, to explore the establishment of additional training institutions, especially in underserved communities. So, Mr. Speaker, we can take it from there. We will link up, and then we will take the conversation from there.
Thank you. Yes, Honorable, do you still wish to?
Yes, Mr. Speaker, my last question may be, and Mr. Speaker, permit me to lay the basis. I'm rightly informed that papers have been sent to the ministry, as the minister also rightly indicated that there's been some proposals. Mr. Speaker, I may want to know that if a formal proposal, one which the minister will rightly deem, befitting a proposal, how long will it take for steps to be taken to consider setting up a nursing training in the municipality?
Honourable Member, you see, at times we have to. In this house, at times it's better to see the minister one-on-one. You've laid the basis. I will ask you to deal with the minister personally. That may yield the needed results. So after laying the basis, I will urge you to try to see the minister and discuss the matter over here.
Very well, Mr. Speaker, I take a cue.
Very well. So, honorable members, let's take the last question. Let's take the last question from Honorable Member for Hemain Lower Denchura, Honorable Lawrence Ajinsam. Honorable Member, you take the last slot.
Thank you, Mr. Speaker. I rise to ask the Minister for Health the plans of the ministry to furnish the Chufu Himai Lower Dinsha District Health Directorate with an administration block and staff bungalows to operate effectively and efficiently. Thank you.
Thank you very much, Honorable Minister.
Mr. Speaker, the Ministry acknowledges the importance of providing a conducive working environment and adequate residential accommodation to enhance the effective and efficient operations of the Chufuhiman Lower Dentra District Health Directorate. As part of the ongoing health sector reforms, the construction of office and auxiliary facilities at the district level has been decentralized and now falls under the purview of the respective district assemblies. The ministry will, however, collaborate closely with the Ministry of Local Government, Chieftaincy and Religious Affairs, as well as the District Assembly, to ensure that appropriate office and residential accommodation are provided to facilitate the effective performance of health staff within the district.
Yes, Honorable Ajinsani, any further questions?
Thank you, Mr. Speaker. Mr. Speaker, I would want to do a follow-up by asking the Minister, per his answer, that the construction of office and ancillary facilities has been decentralized. When was it decentralized? And then what are the steps that I need to take to be able to engage the District Assembly so that Chufu Imail Wadinsha would have the needed office?
Yes, Honorable Minister. Honorable Sunyani Bruni, Sinyan JJ, may you put off here? Yes.
Mr. Speaker, as far as I can recall, for the past 8 to 9 years, the Ministry of Health has not constructed district health directorate offices in the country. It has always been part of the project by the district assemblies. So when they do the constructions, then we will fill in the staff. Thank you.
Yes, Honorable.
My last question. If indeed the minister says that it has to be done by the District Assembly, my follow-up question is, what about logistics, computers, and other things that need to be provided to the Health Directorate? Is it also to be provided by the assemblies or by the ministries?
Yes, Honorable Minister.
Mr. Speaker, as the directorate fall under the ministry, as and when they need the assistance, they have the right to write to the ministry or the Director General of Ghana Health Service, and we will look at it and consider it accordingly.
Thank you very much. Honorable members, on behalf of the House, let me thank the Minister for attending upon the House to respond to members on issues relating to health in their constituencies. Honorable Minister, we thank you and you are hereby discharged. Leadership. We are on statement.
Mr. Speaker, I think we have 2 statements.
I only have one.
Yeah, we can do one and then.
I only have one, and that statement, on Friday, I decided to take the statement today. That is in respect of Ghana cedi as 60. I think today the Bank of Ghana celebrated and launched it. So I think it will be appropriate. I asked the chairman of the Committee on Economy and Development to read the statement in respect of Ghana cedi as 60. So, Honorable Afol, you may take the floor now.
Right Honorable Speaker, let me thank you so much for the opportunity to read this statement to commemorate the 60 years of our Ghana cedi since its introduction in Ghana. Mr. Speaker, the cedi continues to be durable, portable, divisible, uniform, limited in supply, and generally accepted in Ghana. Mr. Speaker, the cedi continues to function as a medium of exchange of goods and services, also serves as a store of value, allowing people to save wealth over time. It also functions as a unit of accounts and values. This enables us to compare the worth of different items. Mr. Speaker, let me use this opportunity to commend the government and the governor of the Bank of Ghana and his team for the effort to end dollarization, i.e. the practice of pricing goods and services in US dollars instead of Ghana cedis in Ghana. That has a tendency to depreciate the Ghana cedi through the increase in demand for the US dollar. To be specific, the government has issued a directive requiring all government contracts to be denominated in Ghana cedis rather than in hard currencies such as the US dollar. Moreover, the governor of the Bank of Ghana, Dr. Johnson Isiama, strengthened this measure by mandating all goods and services to be priced solely in Ghana cedis. All these measures have contributed to making the cedi one of the strongest performing currencies in the world. Evidenced by its continuous appreciation from 17 cedis to $1 in December 2024 to a current range of 10 cedis 30 pesos to 12 cedis to $1. Mr. Speaker, the Ghana cedi has undergone a remarkable transformation since the country gained independence, reflecting the nation's political, economic, and social changes over time. Its evolution tells the story of Ghana's journey towards the economic sovereignty and stability in the face of both internal and global financial challenges. Before independence, in 1957, the Gold Coast, now Ghana, used the British West African pound, sterling, and penny, which were issued by the West African Currency Board. These colonial-era currencies served several West African territories.
You heard the Health Minister, Kwabena Mintah Kando, on the floor of Parliament answering questions with regards to Agenda 111, as well as hospitals, as well as labor issues within the health sector. We return to normal programming. Keep your dials right here on Channel 1 TV.